Hi, this is Swag. Thank you for joining me today. Please be sure to hit the like button and share this video. Today, I would like to speak with you in regards to the outbreak of pneumonia that's taking place in China. Last week, I first heard of this pneumonia outbreak that is particularly happening to children between the ages of 3 and 8. And I was first aware of this with the indication that it had not spread to the United States. Well, we are learning that the first county in the United States, Warren County, Ohio, has to have the mystery outbreak of pneumonia, and it hit several parts of China. And so now Ohio is the first American location to report an outbreak of the illness. The strain of pneumonia, which is being coined as the white lung syndrome, has afflicted at least 142 pediatric cases in Warren County since August. So we do know that 4 years ago, we had a similar situation take place in China, and it was also called pneumonia. However, it wasn't geared like toward children. And China kept it a secret. And, by the time it made its way to the United States, it was really, really bad. And we know that that was what we called C-19. So both China and Europe saw a surge in cases and hospitalizations. It spread and it raised fears among, there may be an outbreak. And we were told that, there was nothing to worry about. And it mimics what happened 4 years ago. Now, according to what I've read, Congress has demanded that the Centers for Disease Control hand over its data so that they can see what actually took place in China because of the secrets that were, held previously. So now, not only do we have this outbreak taking place in Ohio, we also have parts of Massachusetts are also reporting a spike in child pneumonia cases, similar to the outbreak spreading in China and parts of Europe. Now, as far as Ohio goes, Warren County is just 30 miles outside of Cincinnati. And again, as I previously stated, there's at least 142 pediatric cases to date. Ohio's Department of Health has stated that not only is there like an increase of these cases, it actually meets their criteria for being termed as an outbreak. And even though, they're saying this, we still have at the Centers for Disease Control and Prevention. Nationally, there's nothing out of the ordinary in this data. Dr. Amish Adeya, an infectious disease expert from Johns Hopkins University in Maryland, is saying that I would caution against extrapolating one Ohio county, and this is quoted, to a country of 330 million people. So they're saying, we can't just look at this one county and be in fear for the entire country. However, there is an ongoing investigation underway in Ohio into what is actually triggering the wave of illness. So, patients living in that county, which encompasses about 200,000 people, have tested positive. Some of the patients, not the 200,000 people, but they've tested positive, some of the patients, for what's called mycoplasma pneumonia. And that's basically a bacterial lung infection. And what they've determined is that some of the antibiotics don't work on this particular strain of bacterial infection. For instance, of Z-Pack and things of that sort, because the body has built up an immunity to the medication. So, adenovirus is basically a benign respiratory infection. and strep and all of these different viruses can fall under there. And so, several theories as to why children are more susceptible to the illness. And one of them is that they're blaming the fact that we were on lockdown for 3 years. Children are amongst each other in daycares and schools and, in different situations, carry these various illnesses and sicknesses. And it actually builds an immunity. So, kids being around each other is a good thing normally. So, what they're trying to attribute this to is that their immunity has been weakened by lockdowns, by wearing masks, and by schools being closed during the pandemic and things of that sort, which in turn leaves the children to be more vulnerable to certain illnesses. Most of the infections are said to be mild, but those who have recently recovered from respiratory infection are considered to be at higher risk. So, in a release from the Warren County Health District, officials stated that we do not think, and this is quoted, that this is a novel or new respiratory disease, but rather a large uptick in the number of pneumonia cases that are normally seen at one time. So, they're trying to stress the fact that this is not a new disease because they don't want the population to be concerned. And so, I'm just interested in knowing how you all feel about this. It is like a deja vu. We were told not to worry previously, and we ended up with the pandemic that took over our country. And a lot of people lost their lives and things of that sort. And a lot of people felt that if we had known more sooner, we could have better prepared. So, what are your thoughts on that? I do have a news clipping that I would like for you to listen to, and then I would like for you to go to the comments and give me your input and let me know, what you think about it. They're saying that as we approach the holiday season, we'll be coming into contact with family members and friends due to, maybe we have Christmas coming up, we have New Year's Eve coming up, and things of that sort, that we remember to take necessary precautions to protect our health. So, washing hands, possibly wearing masks if necessary, especially if you're ill, if you're not feeling well, to not go, to stay home. Some of the symptoms are fatigue and fever and cough and things of that sort. It's unclear if there are any deaths resulted from this illness so far. And again, that makes me wonder, is that true? We just don't know. And so officials have not responded, requests for more information. So we just really need to be careful out there, especially like I said, during this time. This is the flu season. A lot of people are are tired of various pokes and immunizations and things of that sort. But maybe the flu shot, if you typically get it, go ahead and get it. It won't hurt if you are okay with getting it, just as a precaution. And although it's primarily in children, I err on the side of caution. It's for senior citizens and people who have compromised immunity, suffer doing chemotherapy or, just have various illnesses already. Make sure that you take care of yourself. And if you feel ill, stay home. So, again, I'm going to let you listen to this video, this clipping, and I would love to know your thoughts. So, please like, share, and subscribe, and share what your thoughts are in the comment section. Until next time, tell yourself or type it into the comments, I must, I can, and I will.
Well, there's a mysterious respiratory illness infecting children all throughout China. The World Health Organization attempting to squash fears, comparing it to the common cold. But could this be coming here, or is it here already? Fox News contributor Dr. Mark Siegel is here. You wrote this. Should the world worry about China's new mystery pneumonia outbreak? What's the answer?
Well, the answer is that we never, unfortunately, can believe the health information coming out of China, and the World Health Organization just 3 years ago reassured us that it was a regional problem only in January of 2020, ended up being the worst pandemic in 100 years. That's unfortunate because what Tony Fauci was trying to do in 2003 was build an international consortium of scientists that allowed us to believe information coming out of anywhere that we knew in advance. So I don't think we've actually gotten there yet, which is terrible. Having said that, I don't think this is a new virus. I don't think this is a new strain. I don't think this is bioengineered. There's increasing evidence, Dana, that what this is an atypical bacteria called mycoplasma that we know about. But the problem is there's a growing resistance to it because of overuse of antibiotics in China for it. What antibiotic? Z-Pak. Give a Z-Pak, fine, but after a while, the bug adapts to it. And we're seeing walking pneumonia. It's a common cause of walking pneumonia. The problem with children is they can't take the other antibiotics that work for this, like Cipro, like doxycycline, and again, resistance. So they get sicker. We're seeing it in Denmark, we're seeing it in Netherlands, and we're starting to see it in the United States. I think that's what it is.
Got to put up the map, guys. You mentioned the Netherlands just there and a couple other places, India, China, Taiwan, Vietnam. Dr. Ashish Jha, who used to work at the White House, before that he was at Brown University. We used him a lot during COVID.
Great.
He said, we see unexplained outbreaks with frequency. To which I would say, okay, but I mean, you can understand how an American public would be skeptical about the information they're getting, can you not, based on what just happened with COVID?
They better be. They better be. Now, the other things I didn't mention is it's flu season. We've seen over 1 million cases of flu, RSV, that nasty respiratory virus that causes a lot of congestion. We're seeing a lot of strep throats going around and strep congestion. You were talking about somebody, Dana, that had some kind of congestion, might have been strep.
Well, it was a friend who has had a cough for about a month, and it's gone through different phases of this cough. The doctor that she saw this week said that she thinks it is this virus from China.
I think that that's probably true. I think it's starting to take root here in the United States. I think it's taking root in Washington, D.C. Here's the problem, though, to Bill's point. If it was a new pathogen, if it was something leaking out of a lab, they're not going to tell us. And that's why the American public is always nervous about this. I'm very satisfied, though, in this case it isn't, because of a really good investigation in a journal called Nature 2 days ago that seems to point to this atypical bacteria.
Okay, so Siegel says, for the record, we're cool for now.
We're cool for now. Can't trust China. I don't think it's new. We're cool for now, but I don't. Here's the other point.
Quickly.
It's a resistant bug. We're seeing more and more of that. We have a problem with antibiotics. We don't have the antibiotics we need.
Got it.